Hello! For this test, we'll be showing you how to do DLCO or diffusion. For the first part of the test, we'll be showing you how to do the test and what to tell the patients when you're instructing them to do the test. Then we'll go over some of the guidelines per ATS and how many tests are required to do. And then at the end, we'll go over the results and how to read the numbers based on the efforts that the patient gave, and then what can you do to make the patient do a better job during the test. Okay, so we'll be doing DLCO testing. For DLCO testing, make sure the handheld unit is connected to the box. Hand the nose clip to the patient. Okay, make sure the nose clip is on tight. So for this test, you're going to take four normal breaths, and on the fourth breath, I'm going to tell you to exhale fully, empty out your lungs. Then you're going to take a deep breath in until you can't anymore. Then you're going to hold your breath for 10 seconds, and then hold. After that's done, I'm going to have you push everything out you took in, and then take a deep breath in at the end again. Okay, and throughout the test, you're going to hear some buzzing sound and some hissing sound. Ignore that. Just go on with the test and listen to my voice. Okay, go ahead and place your mouth on the mouthpiece. Make sure it's a tight seal. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Push, 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 push. Keep pushing, keep pushing. Take a deep breath in. Okay, hold for 7, 5, 4, 3, 2, 1. Okay, now push, push, push. Okay, now take a deep breath in again. Okay. We'll save it. Okay. For this part of the test, you are only recommended to do minimum of 2 and maximum of 5. Again, this is recommendation by ATS. It is not a requirement, but a recommendation, just so you can create some repeatable scores. For this test, there will be a 4-minute wait time between the first test to the next test. You can either choose to wait the 4 minutes or continue anyway, but the recommendation is to wait the 4 minutes so the patients can, one, take a break, and also all the gases can get out of their lung tissue before the second test. For this test, we'll demonstrate what a test would look like if you got a test warning message. As you can see, that is barely under the dashed line, so you'll get a warning message like that, which is completed with an alert. However, the effort was still good, so they got a DLCO quality check of B. Okay, so now let's talk about the results. As you can see, this patient got a DLCO quality check of A and B, which is acceptable. Anything between A to D is acceptable. Anything after AD is not acceptable, which will count as a failure. As you can see, there are some percentages here highlighted in blue. This is the percent predicted of the patient. Based on the demographic you inputted earlier, where are they based on the input they gave the machine while doing the test? Again, you only are recommended to do 2 minimum and 5 maximum tests. You are more than welcome to do more or less, but again, it is a high recommendation that you do at least try to do 2 repeatable tests with the patient.